Hi, this is Dr. Lewicki, and I'm going to be talking to you about the nursing process. The nursing process, and we're going to start with assessment. The nursing process is one of the many ways nurses perform critical thinking. And this presentation is an overview of the nursing process, starting with assessment. And then we're going to talk about each component of the nursing process separately. So there's 5 steps in the nursing process, but it is also uh, circular. It's a very dynamic process. We start with assessment. In that assessment, we gather information about the patient's condition. Now, you haven't had physical assessment yet, or we will just be having it in essential concepts, but it's still, that's where you're going to gather the data. Gather the data. You're going to look at the patient's chart. You're going to look at their history. You're going to do your physical assessment, and that's where you get your assessment. Then you're going to diagnose. Now, our job as nurses is not to diagnose a medical condition. We're not doing a medical diagnosis, but we are looking at the information and saying, well, they have a problem with pain or they have a problem with oxygen, and we'll talk more about that in that PowerPoint. We're going to plan, and that means we're going to set goals for the patient and desired outcomes. I want them to not have pain. I want their breathing to improve, whatever it is that we want to focus on, but that's our goal setting. Implement or interventions. This is where I, as a nurse, intervene and do standardized steps that I know help to improve whatever that problem is. And then evaluate is the final step, and we determine if the goals and expected outcomes are achieved. Now, I said we do it in an orderly process, but it is a constant reassessment. And so I can reassess at any point. Evaluation is in fact assessment. I maybe need to say, ooh, maybe that wasn't the best nursing diagnosis for them, so I have to rework that. So at any point, I can interrupt that process or jump into that circle and make a change. So it is part of critical thinking and assessment. We gather information. I said that already. We're going to assess the patient. We're going to look at their chart. We're going to look at their labs. We're going to look at all about the patient, and that's what we're going to gather. We're going to review and analyze the data. And then it could be primary source information, like from the patient, or secondary source. A family member tells you secondhand information, or the charts or other medical providers. So assessment involves knowledge, standards, attitudes, and experience. And you'll see in your book, I didn't include it in every PowerPoint, but you'll see the same picture throughout the nursing process. The nurse draws on knowledge, the underlying disease process, and you haven't learned any of that yet, but you will. Normal growth and development, normal physiology and psychology, normal assessment findings, health promotion, assessment skills, and communication skills. The standards are based on the American Nurses Association scope and standards of nursing practice. Attitudes such as perseverance, fairness, integrity, and creativity. And this is the American Nursing Association scope of practice for nursing. And this is how they've defined the who, what, where, and when, and why and how. Who is registered nurses, and the American Nurses Association also includes advanced practice registered nurses. The what, it's the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. The where, wherever there is a patient in need of care. So I'm going to stop there and just say the where can be home care, it can be in the community, it can be in the hospital, it can be in the nursing home, it can be in the doctor's office, it can be at Publix, it can be wherever there's a patient in need of care. The when, whenever there is a need for nursing knowledge, compassion, and expertise. And the why is the profession exists to achieve the most positive patient outcomes in keeping with the nursing's social contract and obligation to society. One of the things that is part of our social contract with society is that as a college, is that when you enter the profession, you have finished nursing school, we're saying that you have the knowledge, skills, and abilities or attitudes to work as a safe entry level nurse, and that qualifies you to take the national license exam. And again, between the licensing exam and our obligation as a college within the community, that helps with that social contract with the community and our obligations. When each of these questions is answered, the complex considerations and scope of practice become clear in a profession as dynamic as nursing, and with evolving healthcare demands, changes in scope of practice, and overlapping responsibilities are inevitable in our current and future healthcare system. And what that last statement is saying is, and you'll learn throughout the program, is that you learn things that really are in our nursing scope of practice, but more are better done by a different profession like a respiratory therapist or a physical therapist or the nutritionist. And so or dietitian rather. So you will find that there are overlaps in scope of practice. So when I'm doing assessment, there's different ways that I collect the data. I can do patient interviews. We can do periodic assessments. So throughout the day or throughout their care, we might reassess. And we'll do physical exams. And like I said, in Essential Concepts, we'll be doing that. And data can be subjective, which is the patient's perspective, verbal descriptions, or objective. And that's our direct observation. So just as an example, patient states they have pain is subjective, but objective is the nurse observes them grimace when they're repositioning. Sources of data, I have said most of this already, but it's patient and client, so they're the direct source, family, caregivers, significant others, the healthcare team, medical records, other records and scientific literature, and nurses' experience. Part of assessment is building that nurse-patient relationship. We'll talk more about communication later in the semester, but you want to have effective communication. That brings trust building, so it builds that relationship with the patient, and they trust that they're trusting you with their personal information. You provide the presence for them, and one of the ways that the nurse also as a communicator is through rounding. When you're rounding on the patient, and what that means is you're going around every hour and checking on all your patients and making sure they know to expect you at certain times. And there's my nurse. She's here to check on me. You want to keep your interview patient-centered. It can be a motivational interview. You're going to use communication skills such as courtesy, comfort, connection, and confirmation. And we'll talk about some of those when we talk about communication in a few weeks. There's different phases to the interview. You start with orientation and setting an agenda. You just came to the hospital, so I'm just going to complete this history on you, or whatever it is, wherever you're conducting the interview. You're going to do the working phase, which is collecting the data. You're going to use specific interview techniques. You're going to observe the patient. What do we observe for? We observe, is there any signs of distress? Are they dressed appropriately for the weather outside? Is there anybody with them? Did they struggle when they walked? Do they need any devices? Things like that. You're going to ask open-ended questions, but you're also going to ask direct, closed-ended questions. You can be leading, back channeling, probing, and interpreting, and we'll talk about a lot of that in communication. And then the termination phase is when you've gathered your data, then you're going to end your interview. Health history, they're a key component of a comprehensive assessment. It covers all health dimensions. So physical and developmental is the perception of the health status, past health problems and therapies, present health therapies, risk factors, etc. The intellectual is their intellectual performance, problem solving, educational level, attention span, and communication. That's an important part because we need to know whether or not if we teach them something, they're going to be able to absorb it and teach it back to us. Same thing with it. We'll talk about adherence a little bit later and about that. Are they able to understand what their disease process is and what they're expected to do? Spiritual is the spiritual beliefs and meaning, religious experiences, rituals and practices, fellowship and courage. And it's important for that because we need to understand what spiritual practices they have, if they are fasting for long periods of time, and we need to respect that. And so it's important for us to understand that. Social includes their financial status, recreational activities, primary language, culture, heritage, and influence, and community resources. And again, I'm not asking them so much about their social status, but if they don't have insurance, then they're going to be worried about their hospital stay. And so it's important for us to recognize that that may be a problem and that may impact their ability to adhere to any treatments that we have. Um, and environmental risk factors and social relationships, family structure, and support is all part of social. And then emotional or behavioral emotional status, if they have a support system, self-concept, body image, mood, sexuality, and their coping mechanisms. Cultural considerations, very important that we develop a cultural competence that involves self-awareness, reflective practices, and knowledge of a patient's core cultural background. And what you will develop if you're in an area that has some common cultures different from your own is you'll develop an understanding of those. If it is a culture that you're not aware of, then it's where do you start? You start by asking the patient. Cultural humility requires you to recognize your own knowledge limitations and cultural perspectives and thus be open to new perspectives and show your patients respect and understand their individual needs and differences. Do not impose your own attitudes, biases, and beliefs. Professionalism, when you're conducting the interview, you always want to look at the patient and not at the computer. The computer is going to guide you, and that is where you're going to do your documentation. But position yourself so that you can see the patient and focus on them, but still allow you to complete your job. So, what are some of the components of the nursing health history? The biographical information, their age, their name, their date of birth, things like that. Chief concern or reason for seeking care, their expectations of, so I came to the hospital because I needed surgery, or I came to the hospital because I want you to fix this cough that I have. Present illness or health concerns, as well as their past health history. Any family history especially that could contribute to their current issues, psychosocial history, spiritual health, review of systems, observation of patient behavior, diagnostic and laboratory data. Our documentation, record the results of the nursing health history, be precise, be clear, and be concise. Baseline values. So we want to always establish that baseline. Where are we starting from? Record all observations succinctly, which is very much concisely. We just use different descriptors. Record any subjective statements by using quotation marks. And my bullet didn't go over, but it's that stated, my pain is really bad. That's an example of a subjective statement. The process, we're going to data collect, we're going to interpret the data, and we're going to validate the data. And I want you to look at the figures 16.5 and apparently 16.5 are typed twice for examples, but look around there. Recognize cues. A cue is information you obtain through use of senses. A cue is part of noticing. So some examples of that. The dress is inappropriate for the weather. There's odor from the wound. They're grimacing or guarding with movement. Inference is your judgment or interpretation of the cues. Fear, pain, sadness, etc. Comprehensive patient history is a structured database using a standardized process. There are different ways that we look at things. One is Gordon's functional patterns, and that looks at their ability to maintain their normal ability to take care of themselves, their normal function. Pinder's health promotion model, and Watson's theory of caring. And the other type that we may use is a problem-oriented approach, where you came in with chest pain and that's all I'm going to talk to you about. Not all, but that's where I'm going to start with my patient history. Focus on the problem. Then I'm going to organize the data, and we'll talk about this as we progress through here. I'm going to start with the concept map. That's one of the ways. We also will do a nursing care plan as one of the ways, but a concept map places the cues together into clusters. It helps to get to the next stage of the nursing process. And we're going to talk about clustering cues in the next PowerPoint. Thank you for listening.